Welcome to the 8th Annual Louis W. Blackman Patient Safety Awards Luncheon. This is Helen Haskell, Louis's mother. She's president of Mothers Against Medical Error, one of the sponsors of this symposium, and she has been an incredible partner for the last 8 years as we've worked together to impact what's going on in South Carolina in our hospitals and with patients and families and staff. And it's just been quite a journey to be together, and we work closely just about every day. She leads us and guides us on just about everything that we do. So I'd like to introduce Helen, and she wants to give a little bit of background on Louis and MAME and the advocacy work that she does. And I'll turn it over to Helen.
Thank you, Lori. Hospital Association has indeed been a tremendous partner. So I'm not gonna talk long. I'm just gonna say, as some of you know, my son Louis died from medical error nearly 15 years ago now. So it's really been a 15-year journey in patient safety, even though it's only been 8 years for the symposium. And we started with our family and friends, and along the way picked up the Hospital Association very quickly as an ally, and other healthcare entities in South Carolina as well, some of whom are represented here. So we still have a long way to go in our patient safety journey. But when I look back, I can also see, and when I get discouraged, I do look back, and I can also see how far we've come. And I think a large part of that has been from people like our Louis Blackman Award winners, who have really been some of the most important thinkers, learners, organizers, innovators, and cheerleaders for progress in our state. They're really a who's who of patient safety in South Carolina, and they are always invited to the Louis Blackman Luncheon. So with that, I would like to recognize our former award winners who are here with us today. If you could just stand and let us recognize you. Come on, I know, I've seen some of them. And there are a few others who don't seem to have made it in quite yet. So I also wanted to inject a little more personal note today. So this luncheon is particularly special to me because of who our performers are. It's the South Carolina Shakespeare Company and the Columbia College Chamber Ensemble. My son Louis was an actor and a musician, and he was one of the first children to perform with the South Carolina Shakespeare Company. So he began as what I think was probably the world's only pleasingly plump Tiny Tim in the Christmas Carol, and progressed through his share of sprites and fairies and little doomed princes in the magic that really is Columbia's Shakespeare in the Park. But there's a deeper connection as well. What this luncheon is really about is about connecting heart and soul and mind and bringing people together to find ways to move forward, to find hope and even beauty in tragedy, and make the world a better place. Nobody knows how to say that better than Shakespeare. So I'm hoping that you all enjoy your lunch and our performers, and that some of those deeper themes resonate with you and give you some measure of sustenance and support as you go about your important daily work of trying to make the world a better place. But for now, let's just enjoy our lunch. So I want to introduce Brian Tusenik. Am I saying that right, Brian? The president and CEO of THS Risk Management Services, who's going to lead us in giving thanks today. Brian's been with PHTS since 1992 and has more than 20 years of experience in insurance and finance. So please join me in welcoming Brian to the stage.
Please join me in prayer. Heavenly Father, thank you for this opportunity to gather together today to do the very important work of transforming health and making healthcare safer for all. We ask that you guide our deliberations so that we may learn from the work of others. Help us to collaborate in new and different ways to drive innovation and renew our collective commitment to provide consistently high quality care. Bless this meal which you have so graciously provided. Bless those who have prepared it, those who will serve it, and those who will partake of it. Bless this food to our bodies and our bodies to your service. All this we pray in the name of your Son, our risen Lord, Jesus Christ. Amen.
Good afternoon. As you finish up with your desserts, I hope that your luncheon was good, with good conversation and being able to just relax. I'm really delighted to open the Lewis W. Blackman Awards ceremony. Let us honor Lewis and inspire others to transform hospital care by celebrating the passion, tenacity, and innovative work of today's patient safety champions. At this time, I'd like to invite our sponsors of the symposium to the stage to help me give out this year's awards. The South Carolina Hospital Association is Thornton Kirby, and he will also be standing in for Blue Cross Blue Shield. Some things came up over there, and so Thornton is graciously will be giving out 2 awards. Mothers Against Medical Error, Helen Haskell. Health Sciences, South Carolina, Helga Rippon. And PHTS Services, Brian Tusink. It's my distinct pleasure to present the winners of the 2015 Lewis W. Blackman Patient Safety Awards. When I call your name, please come forward to accept your award and take just a few minutes to speak about your work. The Caregiver Award. The 2015 Caregiver Award goes to Dr. Michael O'Boyle. Dr. O'Boyle is the medical director of the St. Francis Osteoporotic Fracture Program at Bon Secours St. Francis Health System and a fellowship-trained orthopedic trauma surgeon in practice at Carolina Orthopedic Center in Greenville. Join me in honoring Dr. O'Boyle.
I don't know if this is going to go up or not. Back in 2006, at St. Francis Hospital, we looked at the results we were having in our hip fracture patients, and our results weren't any worse than anywhere in the country, but they were abysmal by national standards. We had about a 50% mortality rate at 1 year. We had about 68 hours between the time the person came to the emergency room and finally got into the operating room. We had postoperative delirium rates approaching 80%, and we only had about 20% of our patients returning to pre-injury level of function. And unfortunately, this was the accepted standard for hip fractures around the country. And we decided that maybe that wasn't acceptable. And so with the help of really an incredible partnership between the clinicians and the Bon Secours St. Francis administration, specifically Bill Munley, we were able to forge a program based upon patient safety and quality care that is now a gold standard throughout the country. We've decreased our mortality rate at 1 year from 50% down to 18%. We've decreased our time from ER to OR from 68 hours down to 14 hours, and we've really pretty much eliminated our delirium rate. We now have about 80% of our patients returning to their pre-injury level of function. And again, I think all this was possible, one, because we just decided that we weren't going to accept these poor results, and two, we had a hospital that was willing to make a commitment to do the things necessary to improve patient care. Thank you very much for this award, and thanks for recognizing what we did.
And to all of the award winners, we'll be taking pictures afterwards. When everyone else is leaving, we'd like a group picture, so please stay here. Healthcare Executive Award, 2015 Healthcare Executive Award goes to Ann Waters. Her current role was Vice President of Operations at Georgetown Memorial Hospital. She is a nurse with 23 years of experience working within the healthcare systems, where she's been a tireless advocate for patient and staff safety. She just retired, so she is living the life. So please join me in honoring Ann Waters.
As healthcare executives, it's not our choice, it's our responsibility to give safe, quality patient care. To accomplish this at Tidelands Health, we have implemented many initiatives to transform healthcare. We've hardwired processes to ensure that we have no opportunities for error. We've implemented hardwired protocols through CPOE. Our Nursing Shared Governance Evidence-Based Council has developed evidence-based practices and hardwired those into protocols. We've hardwired medication administration through patient identification and bedside scanning. We've utilized a lean initiative recently that we are very excited about, because these are the staff at the bedside determining how things will work best for patient care and patient safety. And it's really exciting to work with the teams at the level providing the patient care so that they can make it right, and they are invested in that, making it right. We've implemented a lean initiative in the emergency department to make sure that we have timely care for our emergency patients, and timely discharge from the emergency room, or timely admission to the appropriate level of care. To ensure patient quality and safety, we've implemented the IOM recommendations for nursing, doubling the number of BSN nurses that we have. We're confident that we will also achieve the BSN recommendations by 2020. We have steadily increased our number of certified nurses. We value education and believe through adequate and ultimate education, we can improve quality and patient safety. We've received designation as a Pathway to Excellence hospital. I'm humbled to receive this award today because I know of all the wonderful things going on throughout South Carolina. As healthcare executives, we are not an island. I'm receiving this award today because of our excellent senior leadership team and my excellent nursing leadership team. Without my nursing leaders and my nursing staff, none of these achievements would be possible. My cornerstone of quality and safety has always been to mentor. As such, I'm confident that my team will be back in the future for the outstanding work and initiatives that they do. Thank you very much for this honor.
The next award is the Innovation and Research Award, and we had two winners this year. They were both excellent. 2015 Innovation and Research Awards go to Dr. Elizabeth Cottrell and Dr. Ann Simonin. If you come up. Dr. Cottrell effectively improved handoff communication among providers, and Dr. Simonin significantly reduced a troubling complication children were suffering in the ICU. Both of these young physicians took the initiative to create a better, safer experience for patients and their families at Palmetto Health's Children's Hospital. Please join me in honoring Drs. Cottrell and Simonin.
Good afternoon. Miscommunication between healthcare providers is one of the leading causes of medical errors worldwide and has been shown to account for up to 2/3 of mistakes that occur in the hospital setting. In general, resident physicians nationwide, including at Palmetto Health Children's Hospital, receive no formal training on how to effectively communicate a patient's plan. This especially occurs when there is patient handoffs, when one team transitions care to another team. In working on the general pediatric floor at Palmetto Health Children's Hospital, I noticed that instructions provided from one resident physician to another during this patient handoff were in general very vague. For example, a child that would be admitted for respiratory distress would have the comment of, "Watch closely." I felt that it was more appropriate to have instructions such as, "Go see the child every 2 hours, and if their oxygen requirements increase greater than 2 liters, then implement steroid therapy." So after noticing this, I decided that something needed to be done. I collected data to compare the written patient handoffs that we gave each other, and then I implemented a lecture series along with the help of the other resident physicians at the hospital, with giving instructions on how to better train residents to give specific examples on patient care. My efforts in this increased our specific statements on what to do with patients from 29% to 75%. Hopefully my efforts with this have potentially decreased the potential for adverse errors, and I am very humbled to receive this honor. Thank you.
Thank you very much for having me. Can you hear me? Okay. My project had to do with improving blood sugar control in patients with newly diagnosed type 1 diabetes at the Palmetto Health Children's Hospital. As some of you may know, type 1 diabetes is an autoimmune disease where the body's immune system attacks the cells in the pancreas that are responsible for making insulin. It can be a very difficult diagnosis for both the children and the parents because it is a lifelong disease, and it also requires a major lifestyle change. Many times the children with newly diagnosed diabetes have to be admitted to the pediatric intensive care unit where they're placed on an insulin drip and they're monitored very closely. Afterwards, they're transitioned from the drip to subcutaneous injections of insulin, and this is what they would normally go home on. We noted that in this transition period, which was about 36 hours, the patients were experiencing elevated blood sugars, and this can lead to longer hospital stays, more finger sticks, more insulin injections, and most importantly, more anxiety and fear for the parents and the children who have just gotten this devastating diagnosis. So after seeing this, I worked with the pediatric endocrinology group to gather data on the incidence of elevated blood sugars during this transition period. I also worked with the pediatric intensive care attendings and residents and the general pediatric residents to come up with a new protocol. After this new protocol was implemented, we ended up seeing a blood sugar reduction of 58.3% in that transition period, and also there was a decrease in the number of correction doses that the patients needed for their high blood sugars. This went down from an average of 9 correction doses to an average of 6. So it was successful. And another resident is actually carrying on this project, making it even better. So in doing this, I hope that in a small way, the overall experience for children with diabetes and the experience for their families at the Children's Hospital was improved. Thank you very much.
The next award is our Patient Advocate Award. And this 2015 Patient Advocate Award goes to Caroline DeLongchamp. Caroline is the guest services representative and staff liaison to the Family Advisory Council at MUSC Children's Hospital. She helps providers connect in a meaningful way with patients and families. She's had an event in her life that has just brought her down this journey that we are so thankful that she's working with us and giving us such strength in connecting the patients and families with the healthcare providers. She's an amazing person, and I really want you to go up and introduce yourself at some point before the end of the day and meet her. She's a warm, wonderful person that has a fabulous story. So please join me in honoring Caroline DeLongchamp.
Okay, I'm a jerk and didn't prepare anything lovely like everyone else did. Thank you, Dr. Elizabeth Mack. I've never known anyone for such a short period of time and felt so connected and loved and appreciated. I would say I am not special and I am not unique. Everything that I do when I walk into the hospital is to honor the men and women who kept my son alive for 19 days in the pediatric ICU. I am not unique and I am not special. There are more like me, and they are coming to a hospital near you, hopefully very soon. I like to think I was special and unique when I first got there. I came back after my experience with Sam as a volunteer, and then that turned into service as the chair of our Family Advisory Council, which led to an unbelievable opportunity to attend a seminar sponsored by the Institute for Patient and Family Centered Care. And not to sound incredibly cheesy, but it wasn't until sitting in one of those ballrooms just like this one that I realized, there's Bev, that my experience and what happened to my son and myself, while very, very important, was over. And while I think it could be a teaching mechanism for hopefully the students and the staff in our hospital, what's more important is the kids that are there today and the families that are there today, as well as the ones that are there tomorrow. And that's what I learned in Atlanta in 2009, which inspired me to go back to my hospital and get to work with some incredibly talented people that I'm lucky enough to be a healthcare stalker in their shadow and learn from them every day. So I would accept this on behalf of patient and family advisors all over the country, but most importantly, the men and the women that I work with at MUSC. So thank you.
So, thank you, Carolyn. Carolyn is the kind of person we actually had exactly in mind when we designed the Patient Advocate Awards. I'm very pleased that she won it this year. And I'm going to introduce the next award because this is another one that's really special to me. This is the Student Award. This is, I believe, our 5th Student Award. We didn't, for some reason, didn't think of it at the beginning, but we've had some amazing young people as Lewis Blackman winners, and they've gone on to do things on the national stage. A lot of them are very active with the IHI Open School, which has pleased us a lot. So it's my pleasure now to introduce the next Lewis Blackman Award winner, Carolyn Weaves. So Carolyn is a senior nursing student at Clemson University. She's vice president of the Clemson IHI Open School chapter. She's passionate about transparent communication and how it can affect quality, safety, and patient experience. So please join me in congratulating Carolyn and hearing some more about what she's doing. Thank you.
Thank you to everyone. It's an honor to be selected to receive the 2015 Lewis Blackman Patient Safety Champion Award. I wanted to highlight some of my earlier experiences that really got me interested in patient safety and quality of improvement. And in my sophomore year at Clemson University, I accompanied my father and his anesthesiology department to Tanzania, where we were outfitting the Bugando Medical Center with intensive care unit, emergency room, and operating room monitors. And these hemodynamic monitors were some of the first ever used in their recovery room. So What I saw was that although there are still mistakes being made in the United States, we have implemented many double-check systems to go behind us and catch our errors often before they even reach the patient. But in places such as Tanzania, optimal outcomes are often difficult to achieve simply because they lack the resources. But what I did notice that in place of lack of resources, they had incredible communication skills between the healthcare disciplines. And it was seeing this communication in Tanzania that inspired me to come back to the States and observe our communication processes and how to improve it. So as a senior nursing student, we are required to participate in a change project. So for my change project, I have been specifically observing communication between the OR and PACU, and specifically their handoff process. So recently I developed a survey based off a Likert scale asking nurses if they were dissatisfied with the current process or satisfied. And my results came back, and a lot of the nurses said that they were only somewhat satisfied with the process and that it did not follow a very consistent format. And on another survey, I questioned how frequently other tasks are performed during handoff. So for example, one of my questions was, how frequently do you find yourself going back to look at the patient chart in order to receive information not given to you during report? And the majority of nurses said that they were always felt like they were going back to find information in the chart that they did not receive. And while I was there, I also noticed that while that handoff report was being done, the nurses were very busy multitasking and trying to set the patients up onto the PACU monitors. And I felt like this took away from them solely focusing on the patient care process and that report and the vital information that is often given off during report. When I questioned them also, they said that they felt sometimes it was very possible that they did not hear certain information being passed off due to the busyness of getting them hooked up quickly to the new monitors in the PACU, and that this multitasking they think hurts them in the long run. And although I'm still working to see what the best way is to meet the PACU's needs, one thing that I'm really looking at is a standardized handoff sheet. And I think that this would make sure the CRNAs and anesthesiologists are giving consistent information every time they transfer a patient, including things such as allergies and potential patient risks and complications. Another way we're looking at is just a general re-education process of the staff, because I now know that the golden standard is that when handoff and report are being given, all other patient care tasks should come to a stop so you can focus solely on the report being given. And I think that doing this will greatly increase the likelihood of them remembering important information from report. And handoff report, as most of y'all know, is a very important part of the patient care process, and it requires a lot of communication. And I strongly believe that communication and empowering our patients as well as different members of the healthcare team to speak up is what will prevent medical errors in the future. We've already implemented so many technological advances that work as double-check systems. So I think what we need now is the courage to speak up when we see something going wrong or feel like something is incorrect. And it was my earlier experiences in Tanzania that made me realize that handoff deficiencies most likely will not be fixed by technology, but rather through improved communication throughout our patient care team. Thank you very much. This has been an honor.
I'd like to again thank our sponsors. They've been absolutely fabulously generous in supporting all the work through this. It's an arduous task going through all of the applications, but they read every single one of them, and it's a very difficult process in trying to select these. But I think our winners this year are just absolutely wonderful representative of what's going on in South Carolina. So our tribute to you today is, as we work in the South Carolina Hospital Association and everything that we do, we try to incorporate heart, mind, body, and soul, because that is the essence of where we are in healthcare. And so a very fun part for us is finding an artistic venue that can celebrate these wonderful awards and the work that we've done. And so I'd like to, first of all, allow the sponsors to go have a seat, because they're probably tired sitting up here. They're standing up here. And introduce the members of the South Carolina Shakespeare Company, and the Columbia College Chamber Ensemble. The Shakespeare Company will be coming in costume. Go ahead and come on up. The ensemble and quartet will need to place their music stands and chairs. They're coming from the other side. Okay, there we are. Okay, so we were on a tight schedule this morning, so I guess we're all set up, and I'm very excited. We have 4 vignettes. You have a playbill that's on your chair that's in conjunction with the blue program is the formal program for today, and then the white sheet of paper is the playbill that will help you direct you through the vignettes. So I hope you enjoy this. Again, heart, mind, body, and soul. Thank you.